quality of care they receive is reflected phlebotomist. Phlebotomy as a profession emerged as a result of technology and expansion in respect. Functions of a phlebotomist. What are all the functions? To obtain blood specimen for diagnostic testing. This is the primary role. To remove blood from donors for blood transfusion. Know facilities, policy and procedures and act accordingly. Properly identify patient. Collect both venous and capillary blood specimens. Select the appropriate and accurate specimen container for the specified test. Properly label, handle and transport specimen to the lab. Perform point of care testing. Observe all safety regulations. Ethics to be followed while entering the room. Outpatient should greet the patient and identify themselves and explain the procedures that will take place. Put the patient at ease. Effective communication is essential, both verbal and body language. For inpatient, proper identification of the patient is mandatory. Ask for full name and check patient ID bank using IPS codes. Hospital identification number is the primary means for identifying the patient. Post vein puncture. Thank the patient after the procedure and excuse yourself courteously leaving the patient with a positive impression of you and the laboratory you represent. Clean up the work areas. What are all the equipment and supplies for vein puncture? Collection tray with test tube rack, vacuum tubes, needles, holders, tourniquet, vein finder, safety disposable units with biohazard stickers, alcohol swab, bandages, gloves, requisition form, consent form, instruction for special tests, and sample collection manual. What are all the problems faced by phlebotomists? Fainting. Gently guide the patient to a couch with patient attender or sister's help. Refusal. If the patient is not refusing to give the sample, then inform the attender and the doctor and act according to their instruction. Nausea or vomiting. Guide the patient to the restroom. After patient settles down, do as per procedure. Convulsions, tremors, excessive bleeding, cessation of breathing, unconsciousness, then immediately inform the take emergency help. Obesity. If the finding the vein is difficult, then find an alternative vein or use butterfly needle. Disruptive behavior. Take the help of the patient attender or sister. Deaf or hearing impaired. Use sign language to make them understand what you are trying to tell them. Communication barriers, then translator help can be taken. Special precautions, blind or visually impaired, then proper instruction has to be given with patient attender's help. Hematoma, then use hematoma has to be avoided. Common errors. Identification of patient, not labeling the tubes, wrong name of the patient on tubes, improper selection of tubes, improper site cleaning, improper specimen collection, not properly mixing the tubes, improper transportation of the specimen. Then sample collection manual. Read the sample collection manual and perform the sample collection as per the manual. Following all this. Avoid needle stick injury, follow spillage protocol, follow IPS codes, follow biomedical waste disposal policy. Laboratory also. Laboratory departments. What are all the departments? Hematology, coagulation, clinical path, immunology, immunohematology, biochemistry, toxicology, microbiology.